Hello, it's Danielle with Oasis Lactation Services, and today we are going to talk about sideline nursing. So I have my baby and I'm in my bed, and the first thing that I think we should really discuss when talking about nursing in a lying down position is being on a safe surface. So I have moved my covers away, so I've just got my fitted sheet on my bed, so everything's smooth, and we've reduced. See, my pillow's already covering up my baby. We've reduced any kind of pullover blankets that could cause any kind of suffocation or obstruct the baby's breathing in any way. And we're going to remember to keep the baby low and near the breasts, in the breastraunt where babies like to be. And pillows need to be kept above mom's shoulder so that the baby is far away from the pillows as possible. So sideline nursing is wonderful for when you need to relax while you're nursing your baby. And at some point, most moms bring their baby into bed with them. So we want to always follow the safe co-sleeping guidelines, even if we're not sleeping while we're sideline nursing, just in case you do fall asleep. So this is for moms who breastfeed exclusively, do not smoke, have not taken a medication that causes them drowsiness, like one of the codeine family of pain medications, or maybe an benzodiazepine, an anti-anxiety medication, or even an antihistamine, something like a Benadryl. If you've taken one of those medications, it's not safe to share a sleep space with your baby, so avoid sideline nursing while you're using that medication. So we also don't want to use this as a starting point breastfeeding position, because the baby, I'll turn toward you, the baby's head will get a great deal of support from the bed. The baby's body will get a great deal of support from the bed. And while that does put the baby in alignment with the ear, the hip, shoulder, and the hip all in a row, which is great for breastfeeding, one of the limitations of this is that the baby can only move the head up, forward, and back. Can't move to one side. And babies really do need that back and forth motion in order to root and find the breast on their own. So once your baby is established and you're not having breastfeeding pain, or you're not having coughing, choking, sputtering, or any difficulties breastfeeding, it's time to move on to sideline nursing so that you can have this relaxing experience. So I'm gonna roll my baby over, and it's important to keep the baby tummy to tummy. So the baby's going to be on the side. We generally put babies on their back, which is the correct thing to do, back to sleep. If the baby's on the back, baby has to turn the head and then lay on the back. So then the baby would be nursing over the shoulder like this. And that's really uncomfortable for the baby and difficult for them. So let's get the baby really rolled in here, and it may be helpful to raise the baby's arm towards your armpit, raise the baby's other arm over, and kind of tuck that body right in there. And let me get my breast. You may want to support the breast some for your baby, and getting the hands involved can be a little tricky because we're trying to keep this shoulder up and away and keep all pillows away. You may find that it's best to not support the breast or not support the baby and let the baby do the work. So pick one to support and kind of just keep this hand up here to keep your head safe, and bring the baby in to latch. Now, if you fall asleep in this position, make sure before this happens that you have all the safe co-sleeping guides followed. If you need more specific instruction about what to do if you fall asleep with your baby in your bed, you can look at cosleeping.edu, which is Dr. James McKenna's website that talks about safe shared sleep surfaces, because there is a risk that you'll fall asleep with your baby. Now, here's where it gets tricky. What to do when this low side is finished and the baby wants the other side? Well, you can pick the whole thing up and roll and reproduce it on the other side, as long as the other side is also safe and doesn't have anything obstructing the baby. There's no blankets or pillows where the baby will be obstructed. Or for some moms who are a little chestier, you can feed the other side, just roll in and feed the high breast while the baby is lying down on the side. So that works for some moms too. You can really go either way. A lot of moms like to roll so that they can, extend both shoulders equally so they're not always stuck on one side when they're side lying. And you may find that your baby does better on one side versus the other side as you're learning and practicing, and that's perfectly normal. So that's side lying in short. Just remember, this isn't always going to be easy with babies that are under 2 weeks and are still really working on developing that latch, and who might just even be dealing with getting over birth. Birth is a pretty intense experience. So little bit older infants, and you can continue side lying with your baby once you've mastered that skill until you decide to wean. And always follow safe co-sleeping guidelines when your baby's in your bed, even if you don't plan to sleep that way, just in case you get very relaxed, because safety is very, very important to us. So thanks for watching this video. Keep following us on YouTube, subscribe to our channel, follow us on Facebook at Oasis Lactation Services, and come to one of our mommy meetups. We'll see you soon.